Welcome to the What If It's Not Depression podcast. I'm your host, Dr. Achina Stein. Today, we are going to talk about the vagus nerve, and my special guest today is Dr. Michael Husmillo. He earned his Doctor of Chiropractic degree from Life Chiropractic College West, graduating Magna Cum Laude, and holds board certification as a Diplomate of the American Chiropractic Neurology Board, a graduate of UC Berkeley in Integrative Biology with a focus on neuroanatomy. His early research explored the link between the immune system and the brain. He has advanced training in functional neurology, neurochemistry, and functional medicine, blending these disciplines to offer a comprehensive brain-based approach to patient care. Last week, we talked about brain repatterning, and this time we're going to talk about the vagus nerve, which is the 10th cranial nerve. Welcome, Dr. Husmillo.
So excited to talk about the vagus nerve and get the message out to the world, to me, why this nerve is so important to our health and well-being.
Awesome. Awesome. Yeah. So I love to have people start with, how they got inspired into going into this work. I know you mentioned your college professor was an inspiration to you. Can you tell us more about that?
Sure. It's actually a pretty cool story because her name is Dr. Marion Diamond. She was actually my professor. I was doing my honors thesis with her. But at the time when she was first doing her research on brain plasticity, it was like in the 60s, she's actually was presenting it to, obviously at that time there were a lot of men professors. But she was telling them that she believed that the brain could still grow after birth and could change, and her research is going to prove that. She told me a story that there was one professor, male professor, stood in the back, raised his hand and said, "Young lady, the brain does not change." And that kind of pushed her to another level of understanding what we need to do with the brain. So because of her understanding how she felt that brain did change, it did. So because a lot of her research showed that if you put a rat in a proper environment, you can actually give it stimulation in terms of exercising, interact with other rats, you can actually change brain. And she felt that. So
Right.
I call it a pioneer of neuroplasticity.
Yes.
There's no fathers, it's the mother of neuroplasticity.
Yes.
And as a result of that, that kind of propelled me into the work I do now, because I think if you give the brain proper input, you can make proper changes. And
Right.
this is from a non-pharmaceutical approach, which I really like to do.
Right, right. Yes. And of course, in the last 5 years, there's been so much research about neuroplasticity and actually proving that the brain can change and grow.
100%, 100%.
So she must feel, I hope she's still alive to see that.
No,
And
she's been instrumental in in I think a lot of people. I mean, she's inspired a lot of doctors, and people became professors because of her. But we should understand the brain, because if we understand the brain, how it works from all aspects, from mental health to just even giving the input that it needs on a daily basis, we can change ourselves.
Mhm. Yes, absolutely. Yes, whether we have a lot of control over the things that we can do, and we don't have to be at the behest of other people to get feeling better. To be honest,
Exactly.
yeah.
Exactly.
So I would love. You're in a great position to really talk about the difference between a conventional neurologist, a chiropractic and or functional neurologist, and a neurologist that does functional medicine. So they're very different. And so when I talk about neurology and I refer people, it's really important for people to understand there are actually three different kinds of neurologists, so to speak, right?
Correct. Yep. Yep. The first one, I work with a lot of conventional neurologists. These are your MDs that pretty much more prescription based. I mean, I have a colleague, she is a Parkinson's specialist, and she knows that when people have Parkinson's, they'll take certain medications, they'll do all the testing. But she also has to realize too that, there's a certain point where the meds just can go to a certain point of helping. So
Mhm.
she refers me patients to a chiropractic neurologist, functional neurologist, because our approach is more brain based. So I'm not worried about the drugs, but what can I do to change the brain? Maybe we could slow down a tremor. Maybe we can improve somebody's balance, because we know that there aren't, medication that says, okay, take this medication and your balance will get better. Not all the time. So we know that there are things that a certain point where the brain needs that input.
Mhm.
We know that through neuroplasticity, and we know that if you give the brain a proper input, things can change. That's what you get from a chiropractic neurologist slash functional neurologist. It's more brain-based therapies, looking what kind of input stimulation from exercise, eye exercises, to light stimulation, to brain X, to like balance exercises. All these things can improve brain function.
Mhm.
And then you have your neurologist who does functional medicine, where at a certain point too, we know that there are things that maybe at a certain level that if we can improve health through functional medicine, that is supplementation, understanding there's other things, vitamins that may be also possible to improve someone's health because there's a certain point when, for example, if you want to, we know that if you want to make someone more dopamine, right? There's a drug to make more dopamine called dopa, but also there's an amino acid called tyrosine combined with B6, vitamin C, vitamin D can make our natural dopamine. So
Mhm.
that's a different approach where,
Right.
okay, there's drugs, but also, hey, can we take an amino acid that we normally get from foods and it might deplete in vitamin C or vitamin D? Well, I need these things called cofactors to make my L-DOPA, to make the dopamine.
Right, right. And the functional neurologists also look at diet and lifestyle and they treat the gut to treat the
Correct.
brain. So looking
Yep.
for pathogens, toxins, stress can affect all of these things. So it's looking at really a whole body base. And I just want to mention that it's MDs and DOs that
Yep.
can do all of these things. So as well as chiropractors, as well as NDs, naturopaths. So
Correct.
that's
Yep.
the beauty of functional medicine is that there's a crossover among many specialties, or I should say, not specialties, but gosh, what's the right word for that? Among the different
Disciplines.
disciplines. That's
Yep.
the right word. Yes.
That's true, though. I think you're right, 100% that we now know that we can understand gut health, which affects brain health and vice versa. We can, to me, it's part of what you always say too. It's a root cause. We
Mhm.
know that the gut is so powerful now and how it connects to the brain via my favorite nerve called the vagus nerve. That's how you're going to true brain gut connection exists that way.
Right, right. Yes. So we were going to really focus in on the vagus nerve today. And you have a process which you call FN2, the number
Yes.
two. And in terms of looking at the vagus nerve and how it may be a root cause for depression. Can you talk more about that?
Sure. To me, it's when we talk about vagus nerve and brain gut connection. We know there's a lot of research now showing that the gut plays a very big role. Obviously, we know that's where serotonin gets produced and dopamine, but also if the gut doesn't work well, that creates inflammation there. And that inflammation can make it to the brain via the vagus nerve.
Mhm.
Hence, FN2 is functional neurology and functional nutrition. So understanding that connection where it's not just gut, but understanding how that inflammation in the gut can affect brain via the vagus nerve. So to me, if we can understand the vagus nerve's role in overall health and well-being, we become a better society. Because I really think a lot of us, or a lot of human beings, are in a state of fight or flight. And
Mhm.
we know when you're in a state of fight or flight, you're more of a stressful state, right?
Mhm.
That's what we call your sympathetic nervous system, where your vagus nerve is part of your parasympathetic nervous system, your rest and digest system.
Mhm.
And so most of the time, you're either going to be a fight or flight or rest and digest. I tell my patient, you're over here with fight or flight. Let's turn the dial to your vagus nerve, which is part of your rest and digest or your parasympathetic system. And that's a very powerful way to understand the brain gut connection via the highway or the vagus nerve. So when the brain doesn't feel right, it's going to tell the gut via the vagus nerve. The gut doesn't feel right, it's going to tell the brain via the vagus nerve. So having a very healthy vagus nerve, to me, or functioning vagus nerve is key to overall health and well-being,
Mhm.
especially when it comes to mental health, becomes the root cause. I think a lot of times we just live in a society where we're always stressed out. I mean, if you look at all the medications, high blood pressure, everything's just to try to calm the system down because we're such in a state of fight or flight.
Mhm.
But if we could start to work on how the vagus nerve, what it's supposed to do for our system, well, I think we kind of slow down some disease processes.
Mhm. Yeah. So, for the average person, sometimes people think that fight or flight is due to trauma and they imagine a very severe situation. Can you help the audience know how the typical person is actually in like the modern fight flight kind
I
of
mean,
way of being?
it could be just the daily thing of getting your kids ready for school and they're not up yet and you're getting stressed out because you're going to be late for school. Or, you're just kind of driving down the street and someone kind of cuts you off because you're late. You're going to be late for something. You respond. So fight or flight could be that because it's just your body's response to something that doesn't feel right. And we know it was first made a long time ago, our fight or flight system, because of the fact that we were being chased by dinosaurs, right? And we use that energy to run away. Well, now we're not. Now we're just in our car. We have to get somewhere, and someone cuts us off, or kids in the back are yelling. You get stressed out just because of that. When it really isn't that bad,
Mhm.
but we're so heightened in that fight or flight state that we can't just kind of take a deep breath and settle back. And that's the problem. That's what I think, if we can start to change that, or so understand, hey, why am I in a state? What can I do to activate my vagus nerve? If
Mhm.
you activate the vagus nerve in a way, then you become more rest and digest. You're more parasympathetic.
That's right. Yeah. I actually had a patient the other day that said that he realized he became more aware of, and he had done years of meditation. It just never seemed to settle him down. And he just became more aware of, why am I like feeling like I'm always running? I'm running away from something. And he sensed that, and he actually like just consciously just said, I'm just going to slow down. There's no reason for me to do things like so fast. I'm just going to slow down and try to enjoy the process of living, as opposed to getting from point A to point B
That's awesome.
in a rush. And so it's just making those small shifts that can make the biggest difference in the world. Yeah, you
It's
didn't.
a big part of it. It's like he just sounded like he knew how to be present. I mean, I think the biggest thing to understand vagus nerve function is like, oh, yeah, I'm just here right now. I'm not
Mhm,
thinking about what I have to make for dinner. If I gotta go do this, I'm just here. I'm
mhm.
like walking and I'm seeing the trees or leaves. That's what I'm looking at. I'm not working like, oh my God, what's next after this where I gotta go to? Because if
Right.
you don't, I mean, the biggest part of activating the vagus nerve is being present.
Hmm.
It means being present. And it's kind of true. I like to tell my patients, happy Vegas, happy life, right? And that's a big part of it. Because I mean, if you think about it, if your vagus nerve is activated, you can't be stressed out because you're not. It's not that system. So
Right.
if you activate your vagus nerve, you're in a better state at that
Right.
moment in time.
Right, right. Yeah. So, can you describe the kinds of symptoms people experience when they are in that fight flight state, or they're at this I call it poor vagal tone, when
Correct.
you have poor vagal tone. So, just so people have a sense of try to figure out whether or not they are one of those people that would really
Sure,
benefit
sure.
from this. Yeah.
I mean, a lot of, the vagus nerve, as you call it, it's the 10th cranial nerve. And, in Latin, it means the wandering nerve, which means it goes from your brain all the way down to your gut. And it has a lot of branches. And as a result of all those different branches, people could present with different things. I mean, we know when someone has a vagus nerve dysfunction, they could have tachycardia, so it can affect the heart.
Hmm.
But people don't realize it has a branch so it helps you breathe better.
Hmm.
Okay. There's another branch that helps your throat so you can swallow better. Sometimes people have difficulty swallowing at times.
Hmm.
It also affects your vocal cords, so people start to get a hoarse voice periodically. All right.
Hmm.
Then you it innervates the stomach, so it helps with stomach acid production. Right? So when people poor vagal tone, acid reflux. Right.
Hmm.
Then it's a branch to the liver to help you detox. And the one thing people don't realize too, it actually has a powerful connection to the spleen, and it plays a role in what we call the inflammation reflex.
Hmm.
So if we have poor vagal tone, what happens? Well, it can't regulate that inflammation reflex. So I get histamine response, I get stuffy nose, I may eat something, I may get a headache, I may get these other histamine responses just because the vagus nerve isn't working as well as we like.
Hmm.
And then the big branch obviously goes to your gut, right, for digestion. But people don't realize that it also affects motility. It's also a pacemaker for the gut.
Right.
So if it doesn't work well, you either constipation or your diarrhea,
Hmm.
right? So you gotta have that good motility as well. So it helps with digestion, motility, and absorption, but also plays a role in the production of, serotonin, dopamine, right? So it helps us feel relaxed, feel happy. So those are powerful things too. When we don't feel right, like for depression, we just don't feel our neurochemistry is off. And we
Hmm.
need our vagus nerve to help us do those things properly.
Yeah, some of the things that as you were going through the list, I've had a few patients where they've had chronic nausea or chronic vomiting, even. It's just this hyper gag reflex, so to
Right.
speak. So yeah, that's poor vagal tone as well. Yeah.
Yep, yep.
Yeah, and even lightheadedness, dizziness can go along with that cardiovascular piece with the tachycardia. Tachycardia is very fast rate, above 100 beats per minute for those who don't know what tachycardia is. So yeah, you did a really nice job explaining all of the kinds of symptoms. And if you have chronic symptoms like that, I think the other one that might be some people don't realize is also insomnia. You can have difficulty falling asleep and staying asleep at night. So, yeah. So, what can you go through? What are some of the things that you do to improve the vagal tone of the vagus nerve?
I think it's, in social media today, right? There's a lot of things that you can look at. How do I improve my vagus nerve?
Mhm.
Well, we know we can do cold water splash, like cold plunges are really good because that initial shock activates your sympathetic, then the vagus nerve kicks and says, okay, it's going to be okay. So you got the cold water exposure. It's also things that people may do. They like to do meditation. That also is things that people have done to try to improve their vagus nerve. Even humming, they try to hum too as well. And I tell all my patients too, because even humming, there's an art to humming to activate your vagus nerve actually. There's a certain
Mhm.
way to hum to activate your vagus nerve. That's just when people kind of like look on their own. But in our practice, we'll measure your vagal tone. We'll measure how your vagus responds if you sit up or stand up, if there's a change in heart rate or blood pressure. But also, vagus nerve has so many other connections and inputs from other parts of your brain. So you can have poor balance. And that could be part of a vagus nerve disconnection happening with your cerebellum. We call your balance centers. Or your eyes could be off because there's a definitely called a vagal ocular system we look at too as well. So there's a lot of different connections in your nervous system that connects your vagus nerve and they talk to each other because
Mhm.
the vagus nerve is so powerful. We call it 80% sensory, which means 80% of it is input from the outside, gets an input, while 20% is motor, so it does its own thing. So 80 means so we give a lot of input to the vagus nerve via we call like non-invasive vagus nerve stimulation, like an ear clip. There's other ways to do that now because there's so many things out there how to activate your vagus nerve from non-invasive like devices they use, right?
Right.
But for us, it's also how is brain functioning? That's
Hmm.
like how's your balance? Do you have any ocular issues?
Hmm.
Those are powerful. How's your vestibular system, which checks your coordination and your balance and how you move. So all those play a role with vagus function because they're all connected to each other.
Right.
Because the vagus nerve is part of the brainstem, but it has neighbors. So if the neighbor is being affected, it's going to affect the other neighbor. And that's how we kind of understand how the brain nervous system works. So but by doing so, we can get a good connection to that vagus nerve.
Hmm. Hmm. That's right. So, and can you talk a little bit about how those connections get disconnected? What?
Uh, It's a great question. A lot of it too, people have traumatic brain injuries. Can
Hmm.
disconnect that. People have a concussion. People have the stroke. Even people just get life. Life can just happen. They get so stressed out, they start to lose that aspect, where they can get that disconnect with all parts of the nervous system.
Hmm.
And that affects your mood. So they all kind of, and there's things recently we know too that, long haul COVID is a big part of it. A lot of research shows that people with long haul COVID may have shown mild symptoms, but it's been shown that the virus itself seems to attack that vagus nerve.
Hmm.
That's why people can present with 5 different symptoms, see a GI doctor, see a cardiologist, see a neurologist, see a psychiatrist, and realize, wow, all this stuff is weird because my thing's not right, but everything is back normal sometimes with these testing. It's
Hmm.
because the virus seems to attack that vagus nerve too as well.
Right. Right. Yes, it gets inflamed in so many different ways.
Correct.
It sounds like from the way you describe things that you could have just some branches affected and not all the branches.
Right, right. And you can. And when you have some people have all these different symptoms, but it's enough to have one problem, like have B tachycardia, or you have digestive issues. People don't realize, I think, if you try to work on digestion, watch what you eat, you take a probiotic, but realize, well, what caused it to go haywire a little bit? We know some
Hmm.
inflammation, but what about the vagus nerve that helps with that motility, with the digestion, so things work better too? So I always think it's important to, like you say, find the root cause, get that whole system working better. Because you'll have the symptoms over here, but the root cause, what's a big part of that is, to me, when it comes to digestive health or brain inflammation, it's via the vagus nerve.
Hmm. That's right. Yes. I'm curious to know if there's anything that you could talk about as maybe some simple techniques. I know you have to do a full evaluation to know what's right for a specific person. But if you can give examples of maybe one of your patients that you've had and how quickly you can do an evaluation and maybe even get them better, that would be awesome.
Sure. One of the things that we know that there are things that you do to activate the vagus nerve. Like I said, humming,
Mm-hmm.
but there are other things on a deeper level, neurological level, you can do to activate that vagus nerve too as well. One really cool way is activating your frontal lobe because we know that the frontal lobe has connection to that system where your vagus nerve is and your fight or flight response. It regulates that system. So if the frontal lobe doesn't work well, people start to get overexcited. Not overexcited, they start to get the inability to control their stimulation where they start to get a little bit more stressed out. Okay. But your frontal lobe helps control that. So one really cool exercise to activate the frontal lobe is we call dual tasking, is where you're just going to walk, like your normal walk down the hallway, if you're going down the street. But then you're going to say every other month of the year. Well, you'll walk and say January, March, May, July, September, November. But most of the time, we'll see people do that at cadence. They'll take a step per month. They'll take a step, say January. They can't do it in rhythm, which
Mm-hmm.
happens a lot. So it's called dual task. Lots of people do that. But it's powerful because if you can activate your frontal lobe this way, you're going to get an input into the vagus nerve and start to activate that as well and regulate that nervous system better too as well.
Mm-hmm. Yeah, you mentioned that there are people on social media doing all sorts of exercises and pointing,
Yep,
just,
yep.
doing the. I mean, would that be an example of a dual task?
Yeah, dual tasking be that, it's very, I mean, it's just two things at once, but it's
Right.
the important thing of just activating that frontal lobe because it's the key aspect to getting that vagus nerve to work better.
Hmm.
Right. To me, I mean, if even if people simply just work on their balance, like they do simple, we call it a tandem stance or a tandem walk where they go heel to toe, like
Hmm.
that, just like you're walking down a straight line. Some people have a hard time doing that, but just trying to do that, working on balance
Right.
can activate the vagus nerve too as well. And
Right.
there's a variety of there's a variety of balance of exercise you can do out there, but it's key, because it's not just humming or gargling or meditation, but doing these different things from like a dual tasking to working on your balance can activate the vagus nerve too as well.
Hmm. Yeah. Even just standing on one leg and then
Right.
switching off to the
Just
other
switching
leg.
up. Yep.
Right.
What am I doing? Well, yeah, it's balance, but that balance center has connection to the vagus nerve. And another really cool, powerful exercise we tell our patients actually is if you activate your large muscles, like doing squats, right?
Hmm.
Sit down, do squat. But when you activate your large muscles, those are basically like your quadriceps and your core. What's powerful is that all of a sudden that activation you activate the vagus nerve, which then sends signal to part of your brain that floods the brain with adrenaline. So it starts to wake you up too as well. But
Hmm.
that kind of exercise can activate the vagus nerve and then also create clarity in your brain because you're activating with you're basically having adrenaline flooding your brain so you can be more alert with things.
Hmm.
So these are kind of powerful exercises that people, it's free, just have to do it. And if you can do these things that are not just, besides the humming and the gargling, these are other things to do to help improve your vagus nerve. Because to me, I tell patients, boy, try to think of activating your vagus nerve 3 times a day if you can. Because most of the time we're stressed out. So if you could just turn the dial a little bit, guess what? I've activated my vagus nerve and I want to create that neuroplasticity to my vagus nerve.
Hmm. Right. And I think people need to understand why humming and gargling are helpful because the vagus nerve does course through the neck here. And it does, as you said, innervate all of the organs. And there are people who can have, there's actually appliances like the
Right.
Pulsetto
Pulsatile, yep.
that pulses through here and stimulates the vagus nerve. So there are different appliances that people can get to stimulate the vagus nerve in that area. But the humming stimulates it from the inside, and the gargling, but it has to be pretty significant gargling,
Yep.
not
Yep.
just a little gargling.
No,
It's
it's got
hardcore gargling.
hardcore, exactly. Like even the humming, I think people hum incorrectly where you gotta elongate the H when you hum. You gotta go hum. You'll
Right,
feel the vibration at the back of your throat. That's what you do. When you feel that vibration at the back of your throat, you've done it. You've activated the vagus nerve.
right.
Yeah.
Sometimes it's helpful to even feel the vibration in your chest,
Right.
and
Yep.
deeper into your lungs. So if you can hold that hum and get really deep, that makes a big, big difference. And
It
people
does.
feel a lot calmer. So it's not just like you're humming a song.
No, yeah, you're gonna really focus on, okay, I got to feel like you said that vibration in my body. Because once you feel that vibration, boom, you've done it. Because the
Right,
vagus nerve responds to vibration.
right,
It can feel that when it does it. Okay, you've done it, and you can feel a sense of almost calmness that occurs, I think, in my opinion.
right, right. Absolutely. There's so many things that we could talk about about the vagus nerve, but I feel like we've covered it all. Is there anything that you want to mention that maybe we haven't discussed that from your standpoint that's really important for people to know?
I think to me, when it comes to the vagus nerve, just if you can learn to activate that, to me, because that creates I'm on this mission to create what we call a parasympathetic lifestyle, where
Mhm.
sympathetic, right, your fight or flight. Parasympathetic is part of your rest and digest, overall well-being. And to do those things, I think we can improve health, but also slow down diseases, maybe prevent some disease processes from happening. So I
Mhm.
tell my patients, try to lead that lifestyle instead of parasympathetic lifestyle. So you're more relaxed, so you can digest your food and be present.
Mhm. Right, right. And it's sometimes I find it's the reason why people don't get well. They're doing all of the things, they're eating right, they're sleeping well, or generally, but maybe not a deeper sleep, a more relaxed sleep. They're exercising, but they might be over exercising. They feel like they're doing all the right things, but if they're doing it, and I haven't come up with a really good word. If they're doing it stressfully, then it's not going to work. You got to sort of change your mindset and attitude about it. It's sort of like going to a yoga class and doing power yoga just to check off the box that
Right,
I did the yoga class, as opposed to really being present in each of the poses and feeling it in your body and relaxing into it.
exactly. I agree,
Yeah,
100%,
it's a
100%.
total different way of being in doing this work. So some people, and so if it's rooted in trauma, this fight flight, then it's really, really important to do the brain repatterning or the brain retraining that is due to limbic activation. And
Right,
sometimes the vagus nerve stimulation isn't enough. You kind
right.
of have to do both.
I
So
agree. Yep,
yeah, and then when the body calms down, then you're putting it into a place of healing.
yep, 100%.
Yeah, awesome. So thank you so much, Dr. Husmillo. I really appreciate you joining us. Yeah, we will put in the show notes your contact information. It was at your website, ocncenter.com. And you're also, looks like, on Instagram.
Yes, on Instagram too. Yeah, we talk about a lot of Vegas stuff and good exercise about the Vegas Serve, my Instagram page too.
Cool, cool. That's really great. Yeah, and I know you have a free 15-minute consultation available probably on your website that if
Yes,
people were
100%.
interested in working with
Yep.
you. And you're located in Troy, Michigan.
Yes. So
Yes.
I do a lot of virtual consult too as well throughout the world on vagus nerve health. So, we can always work with people virtually too if we need to.
Awesome. That's really, really great. Well, you have a great rest of the day and weekend, and thank you again.
Thank you so much for having me. Take care.